I know there's probably a lot you can't tell us, but from what you can tell us, are there one or two snapshots of Gen AI applications in healthcare that AI 71 is working on that you can share with us and help us understand, see what's ahead?
Yeah, building on some of these products, there's a lot more that you can do. And so we're also working on helping ease the burden on the administrative staff and ensure a better communication between the patient and their health providers. And a lot of those are enabled by these generative AI technologies that we're working on.
Welcome to the Health Beats podcast, brought to you by Abu Dhabi Global Health Week. The Health Beats podcast series is your window into healthcare industry news making headlines and the role of Abu Dhabi and the UAE in unlocking global healthcare momentum. We give you insights into the future of the global healthcare sector and Abu Dhabi's contribution to it. I'm your host, Lara Satrakin, and in this week's episode, I'm joined by Mehdi Ghissassi, Chief Product Officer at AI 71. Our conversation today is entitled AI's Healthcare Revolution, Gen AI Breakthroughs and Future Impacts. Mehdi, welcome to the podcast.
Thanks, Lara. It's great to be here.
You have worked for major tech giants. You've had a long road in AI, and now you're at AI 71. How has your perspective on AI's intersection with healthcare and transformative impact on healthcare evolved over that time?
Yeah, I was lucky enough to work in a number of organizations where health and AI were involved. Healthcare is incredibly important, right? Like we all have had to deal with the healthcare system for ourselves or for our loved ones and seeing how that can sometimes be very complicated. AI is the most important scientific endeavor of the moment, right? So the intersection of the two is incredibly exciting for humanity to work on and see. And over the years, we've seen how a lot of the early promise of AI for healthcare has been manifesting as clinicians integrate more AI tools in their work, as patients benefit from these solutions too, and as the administrative burden that exists in healthcare systems is offloaded by a number of AI tools. So I've been incredibly excited to see these promises manifest themselves. And we can see it even today with perhaps the Nobel Prizes that were given for drug discovery and the impact of AI on understanding proteins, that AI is making more and more strides into the healthcare space.
Has it met your expectations so far? What has surprised you in this field?
It's the intersection of two very complicated fields, right? Healthcare has a number of challenges that people think about along the quadruple aim framework of better health for individuals, better health at the population level, reducing the per capita cost of health, and improving the well-being of healthcare teams. So those are incredibly complex challenges, right? At the same time, AI is research and science, which is in some ways unpredictable. And so I've been amazed at seeing the progress and the real world impact that these technologies have had for us. And so, as much as you can't really predict when breakthroughs will happen, you can only be amazed at when you see them happen. And so, to answer really your question, I didn't have an expectation because in terms of timing of these, but I was very convinced that they will happen. And that's what's going on currently.
Some of our listeners have heard about large language models. Can you help us understand how they play into the healthcare equation? Where do they potentially change things? What products do they give rise to now?
So we just touched on the quadruple aim, right? Like the four main challenges that usually healthcare systems try to optimize for. Large language models are these advanced AI models that are trained on massive amounts of data and that then can understand, generate, and manipulate human language, right? Some of them also have multimodal abilities, as in they can understand the images, video, audio, and also like converse with you in those modalities. So a lot of these have applications in the healthcare space, either to unburden clinicians from their workloads, right? Like if you imagine you go see a doctor, you probably notice that they spend a lot of time writing notes, asking you questions, and very little time is then spent in the relationship with the patient, right? So these tools, LLMs, can help unburden some of these, right? Like they can generate the clinical notes, they can summarize them, they can take over a bunch of the workflow that happen after that. For the admin staff, right, like who has to maybe give you a call, follow up with you after the appointment, a lot of these tasks can be offloaded there. Similarly, for the understanding of images, video, there's a lot of medical imaging, right, that's involved in the clinic, and so these tools can help triage some of these so that doctors only look at the ones that are more complex for the machines to understand, and hence reducing the burden on them. Similarly, for patients, right, like you can have conversations with LLMs that have been fine-tuned on health data and hence are able to at least give you a first understanding of the condition that you have. So as you can see, like the abilities of these LLMs can help the different constituents of the health system with different tasks that ultimately help them make sense of the condition that they're dealing with, or the tasks that they have to achieve, and give them more time to focus on other areas of the patient the patient relationship with either their provider, their clinician, or the admin staff at the clinic.
So those listening tasks, those follow-up tasks, writing some of the rote, and that's from the language that is being collected across the healthcare sector now, so that essentially this AI can help process that language as data. It sounds like the basic
Yeah,
explanation.
absolutely. It's basically right, like you're with these LLMs, you're equipping humans with a number of tools that can take over some of the tasks humans do. In the case of the healthcare setting, there are a number of tasks like summarization of encounters, follow-ups, like conversational follow-ups that can happen, and also helping with diagnostics, right? As these LLMs might have been trained on healthcare data, so they can behave and help clinicians diagnose some cases.
Gen AI, generative AI, is certainly a buzzword. We hear about it a lot. In the context of healthcare, what does Gen AI do? What does it mean? What's the impact it can have in terms of revolutionizing the field?
Yeah, absolutely. Generative AI is has been around for a while. It's defined generative AI as opposed to other types of AI who more classify things. Like generative AI means that it will generate something. And so, in the case of health, LLMs are one kind of a generative AI, right? So everything we said before actually applies here. So things, as you summarized, as removing the administrative burden on doctors by automatically generating the clinical notes from the audio of the consultation, supporting diagnostics by suggesting options that are based on the consultation and the medical data, helping the administrative staff in the clinic handle operational tasks such as booking appointments, follow-ups with patients. Beyond the clinic, right? Like there's an area of healthcare which is around drugs, right, and medicine that people have to take, where generative AI could help in the drug discovery phase by coming up with compounds and designs that could be accurate for a given condition.
So, drug discovery is a big one for generative AI.
Exactly. You can imagine generative AI tools that can help you with drug design, where the system suggests compounds that could be good candidates for given medical conditions.
We're seeing AI companies and health departments start to partner up and experiment. What are those partnerships delivering? How are they pushing the boundaries of healthcare delivery?
Yeah, it's a great question, actually. And having been part of a lot of these collaborations between AI players and health systems, I'm very pleased to see more of them popping up. It's very critical to ensure that there is a matching between the technology being developed in a lab with the actual needs of the health system, right? So that you ensure that there is both product market fit and adoption. And so what these enable is exactly this, right? Like that you ensure that what is being developed in a lab is actually useful. So you get feedback from clinicians, folks in the healthcare system about what they need and what their pain points are. You feed that back to engineers, researchers, product managers, and so on and so forth. And then you come back with, hey, this is a product that maybe solves your needs.
So, I mean, any big findings so far, breakthroughs, thoughtful outcomes that you think are worth highlighting from that intersection?
Well, there are multiple, right? Like in a previous life at a previous company, we worked closely with the hospital to develop a model that helps read 3D scans of the eye and then diagnoses diabetic retinopathy or macular degeneration, offloading the clinicians from doing this work, and also being at a level of accuracy that's better than the best doctor out there because it's been trained on lots of data, right? And there are multiple examples of these where you can, either in medical imaging or in diagnostics or in even patient deterioration, predicting patient deterioration before it even happens. There are tons of such examples all over the world.
From that intersection conversation between healthcare providers and tech builders coming up with those sorts of solutions?
Because you need to understand what their needs are, what their pain points are, and then go work on that, right? Like you can't come up with a hammer and then hope that you'll find nails that fit that hammer.
No doubt. Patient data privacy. It's a crucial area. It's crucial for healthcare, crucial for AI, and I don't think that average users understand how it really works. How does it work? How are AI developers themselves balancing the need for vast information with those privacy protections? How anonymized really is the data that they're using?
It's a very important point. Health data is incredibly personal, and as such, there are a number of rules and regulations that are country specific that people need to adhere to be able to manipulate it. In the context of health technology, there are a few ways that people ensure that those rules are adhered to. So one is access controls, right, and auditing. So you have to ensure that the people who can access that data are actually allowed to do it, and log all access to sensitive data so that you can detect when there's any unauthorized use. Another level is to build these AI models, you need a lot of data, right? And so you can anonymize or de-identify the data, as in you remove from it all the PII. Because in reality, the model needs the data, but it doesn't need to know that that specific data is linked to this person or that other person. So there are techniques to de-identify it, as in you basically de-link it from the names of the patients. There are other techniques like federated learning where the data will not leave the place where it is, but it will be trained. The model will be trained on data that's sitting in different pockets, but that is not accessed by the person who's actually building the model. There are lots of other techniques like encryption, right? Like where this time you will encrypt the data and then you can train the model on the encrypted data without ever decrypting it. The last bit, perhaps worth mentioning, is synthetic data, where this time what you will do is you will generate a synthetic data set from the underlying data, and you will train on that synthetic data, not on the original one that is tied to an actual patient or human.
But someone still holds that original data set.
Yes. The moment that there is data, it is stored somewhere according to a number of rules, right?
How do you feel about the data privacy equation? Where do you think we are as a species? There's so much concern about it, particularly in Europe, some in the US. How do you think we're doing? What do you think needs to be done to give people more confidence about that data privacy piece?
I'm very confident, right? Like there are rules in every country, and I believe that they are adhered to by those who need to. When they're not, there are investigations, and people can highlight that, and there are fines, etc. So yeah, I don't have any specific issue with this particular point?
More broadly, when it comes to regulation, the healthcare industry is a highly regulated industry. AI regulations are still being figured out country by country, region by region. How do you navigate the balance between rapid innovation in AI and these regulatory requirements that exist? What might come next? How do you make sense of it all?
So yeah, it is true that, as we touched on before, the pace of progress in research is non-linear. So we'll have moments where you have a breakthrough, right? And you don't necessarily want to create regulation that hampers innovation, but you don't also want to create innovations that have negative impact, right? One way to think about this is that these technologies impact in given sectors, right? And those sectors already have their regulations. And so you can first start by using the regulation that exists in that space here in healthcare. Second, there is continuous dialogue, right? Like between the various stakeholders involved. And so as people are coming up with new ideas, they seek feedback from regulatory authorities on how should they be treating this, at the same time that regulatory authorities are keeping an eye on what are the latest developments so they're not caught flat-footed when things happen. And these are things that continuously exist in between the stakeholders in the field. Sometimes you will have some that complain that it's not fast enough for them. Others will complain that maybe it's too fast for what's happening. Ultimately, they end up meeting in the middle.
Sounds like a dance between
Uh,
and across.
yeah, it is actually, it's a beautiful way of putting it. But ultimately they have to tango together, right?
Yeah.
You can't even if you've done some breakthrough, you can't deploy it if the regulatory authorities are not happy with it, and you can't regulate something that you don't understand or know. So it's absolutely necessary to have this dance, as you mentioned.
Is there an example you could pick out from AI 71's work where you feel like Gen AI has led to a major breakthrough, an improvement in a healthcare process or treatment?
Yeah, absolutely. Working with partners in the clinical space, we've been able to pilot and deploy tools that help with clinical note summarization, and that we see how it offloads from doctors parts of the work that they do, giving them more time during the consultation to actually spend with their patients. So that's probably one that we're very excited about.
I know there's probably a lot you can't tell us, but from what you can tell us, are there one or two snapshots of Gen AI applications in healthcare that AI 71 is working on that you can share with us and help us understand, see what's ahead?
Yeah, building on some of these products, there's a lot more that you can do. And so we're also working on helping ease the burden on the administrative staff and ensure a better communication between the patient and their health providers. And a lot of those are enabled by these generative AI technologies that we're working on.
Looking ahead 5 to 10 years, which emerging AI technologies do you think are going to have the most profound impact on healthcare, especially when you think of that nonlinear growth in AI, far beyond listening and summarizing? What sort of changes can AI create potentially for the average patient and doctor?
One thing there, right, like is as we generate more and more data, uh, we're able to find insights into it, right? And so one of the things that I'm incredibly excited about is this idea of medical forecasting, a bit like we do weather forecasting. So the ability to predict what might happen to a patient way ahead than it actually happens to them. And that we already see the premise of this. There's work that had been done where you could predict 48 hours a patient deterioration before doctors even think about it. And actually, some people's lives were saved thanks to this. And so as we continue, right, like with integrating various data sources, both medical and non-medical, such as the social determinants of health or multi-omics, that helps us further improve our understanding of patients and then improve the models that we use to stratify, to predict what might happen to patients. One of the underpinnings of this will be progress in generative AI around the reasoning abilities of models. So think about like system two versus system one type thinking, right? And then when we have that, we'll down the road be able to have more personalized medicine, link costs to outcomes so that we can better treat and triage where patients should go so that we reduce the cost and the burden for the health system. So yeah, the summary is really in the next steps of reasoning will and planning will should massively help improve the way that we do medicine, combined with more and more data that we're feeding these models.
So it's fair to say that as AI is able to reason more through this data, it will be able to strategize on an individual's health and a population health system.
Yeah, absolutely, absolutely. It would suggest things for you to do so that you avoid bad episodes, and prevention is actually way better than intervention in health. It costs way more, so it also will reduce significantly the costs on the overall healthcare system.
Overall, thinking big picture, we've touched on a lot of this, but really in the macro sense, how do you envision global collaborations shaping the future of AI in healthcare? What other players can come into this mix? What do the joint ventures or collaborative projects look like? And what role does AI 71 play in that kind of landscape?
Yeah, it's critical, right? Like to collaborate, as we touched on before, because there are so many stakeholders and fields that are involved in this space. So, from an AI perspective, the first one is data sets, right? Like you can't really do anything smart in this field if you don't have data and clean data and a lot of data. So, the first one is probably building and sharing data sets. The second is collaborating on research and applications on these data sets, right? Like you can do new findings, think about products to build on top of that. And then the third one, which we touched on also before, is partnering on regulations, right? Like figuring out how will this actually manifest in the real world? What rules should people adhere to? Healthcare is not a space where we should move fast and break things, as is usually said, right? Like it's a place where people should thoughtfully advance towards better outcomes. Here at AI 71 and TII, our research lab, we're not only open to doing that, but we're also laying out the groundwork of this with various partners around the world and locally that we work with.
You were educated in France, spent a lot of
Yeah.
time with Silicon Valley. Now you're here in Abu Dhabi, in the UAE, in the GCC. So, particularly looking at the fact that so much innovation is happening in the UAE, particularly through partnerships. And Silicon Valley is Silicon Valley. What does that part of the world have to teach this part of the world, and vice versa? What have you gathered from both places that you think they ought to perhaps trade notes or learn from each other's approaches?
Yeah, look, people should always trade notes, be it only to have an understanding of what is happening and how others are thinking about similar topics. I think that one of the amazing things of Silicon Valley, right, like, is the pace and intensity of innovation, right? Like everybody is bustling with ideas and wants to change the world really quickly. One of the great things about the UAE also is the pace at which things are changing and moving forward, and the big investment in research and development. So I think the Silicon Valley could learn by seeing the ability to plan and execute on those plans versus the grassroots events. And here we can also probably learn from the ability to try out crazy ideas and learn from failure.
It seems like both parts of the world do that. They try out big ideas and probably have their own interesting sensibilities toward that innovation, the big ideas.
Yeah, absolutely. I didn't necessarily feel that it was different. I think it's maybe the approach to it that could be perceived as a bit different, but that could also be part of the organizations that I've been in.
So, a big opportunity to trade notes is the 2025 Abu Dhabi Global Health Week. What would you want to see? What are your key messages when it comes to AI in healthcare that you want everyone attending to understand? or to be frankly chatting about around the water cooler, as they say.
Yeah, so I think one of the main thing is that there is really a massive opportunity to improve health systems by infusing AI into various areas of them, and in we could it would be very important to also do that in a responsible way while reducing the unsustainable costs of the healthcare system. So, yeah, I would love for people to investigate what that means and build the partnerships for them to execute on those.
And what are the hot topics? What do you think are either the big open questions when it comes to Gen AI in healthcare, or the issues that keep people up at night that they really want to solve? What would be your designer set of subjects that you want everyone at the table to talk about?
Yes, so one of the main ones, right, is around factuality. So as you know, the LLMs, if you prompt them with the same question twice, they sometimes and very often reply different things. And that's an active area of research. If you wanted to deploy the full power of this system in healthcare, you wouldn't want them to do that, right? And so there are ways to constrain that creativity, but they also limit the powers of the LLMs, right? So one of the main topics is really making these more factual. The second one is how do you integrate them in a clinician's workflow, right? Technology has been in between doctors and patients since it has been introduced. Patients have felt that their doctor is spending more time on their machines, typing stuff and recording things than actually talking to them. So that's the second one, right? Like as we add more technology into this, how do we actually integrate it so that it doesn't come as a blocker to the patient doctor relationship? That's the second one. The third one is around the regulatory frameworks, right? Like how fast can we start to experiment? Is there an ability to have sandboxes where you can try things before it's all finished and done? Because the reality is, as we gather more data, systems will keep improving all the time. So it's not going to be a like there won't be a stop time and then you go and you can change your algorithms will continuously improve and change. And so how do we deal with that versus the previous regulatory framework where I build a machine, I get the approval to use it, then I use it, and at the same time I'm building the next one, and I go, I ask, I wait all that time and get it back. So that perhaps like the three main things that would be great to have views and thoughts on.
We were talking before about how different countries, different regions are answering those questions in different ways, and some more perhaps innovation friendly, more leaning toward the desire to create those breakthroughs and less restrained by regulation. So when you see these topics like data privacy, algorithmic fairness, the regulatory material, the final form that that's going to take, do you feel like there has to be a consensus globally that these conferences have to bring everyone together to talk about those things? Or is it all right that you live in a multi-speed world? It's just going to mean that different things are coming out of different environments.
Yeah, I think it would be great if people learned from others in this space, and it would be fascinating if there was a as global as possible of a consensus in this. But it's also okay for people to move at different paces depending on their needs, requirements, constraints, objectives. So yeah, on this one, I think it's actually not an issue that you'd have diverging paths that will also help to see which ones might be better for others down the road. So yeah, I would be okay if people had their own path based on their needs.
In past episodes of the Health Beats podcast, we've talked about how having this data set from this region, from the GCC, from the Arab world, is a very special thing. It wasn't clear that that data set was going to get all the love and innovation that it might have gotten if there weren't so much innovation happening here now, which is really exciting. But you're a product guy. You're building product in a particular environment where there's an encouragement to do so. There's a lot of enabling environment for that to happen, including the regulatory frameworks. Is that just going to mean that products are going to be built here and sold to the wider world rather than the other way around, which has often been the case?
Yeah, that is one of the desired outcomes, right? That we can also, as we do research here, we can also build products on top of it and sell them to others and have users all over the globe that benefit from them.
How do you see AI 71 contributing to the dialogue and potentially the collaborations that could emerge from Abu Dhabi Global Health Week? Is there a vision for AI 71 playing a particular role in bridging the AI world abroad and in the Middle East?
Yes, definitely. So we're very excited to be sharing our expertise there with other stakeholders in the industry. We're equally interested in contributing our knowledge to the regulatory conversations and look forward to partnering with like-minded institutions to keep advancing the field.
Mehdi Ghissassi, thank you so much for joining us.
Thanks so much, Lara. It was a pleasure.
Thanks for listening to this episode of the Health Beats podcast. For more healthcare industry news, visit the Abu Dhabi Global Health Week newsletter. The link is in our bio. Thanks for listening. You can like, subscribe, and continue to follow Health Beats by Abu Dhabi Global Health Week for your global healthcare industry digest.